It's me, Dr. Abdul Fatim. Today, our topic for the veterinary doctors during our Captain Vet training program is the emergency doses for the dogs and cats. There are certain emergencies that we face during our clinical practice. First is the stage of the cardiac emergency. If we have a patient, we have a pet that is presented at our clinic with the cardiac emergency. We have to use the first one injection is adrenaline injection. Adrenaline injection is also known as an emergency drug that is commonly used at a pet clinic. Normally, the dosage required to inject adrenaline in the pets is 10 microgram per kg IV every 3 to 5 minutes until return of the spontaneous circulation. And if we calculate it into ml, it will be a 1 ml per 10 kg body weight. Second one is the emergency condition that we face during our clinical practice is hyperkalemic myocardial toxicity, in which there is disturbance in the calcium glucose level in the body, and we are using calcium at the rate of 0.5 to 1.5 ml per kg. Second one, we can use insulin at the rate of 0.5 IU international unit per kg. We can also use as a fluid therapy dextrose. Dextrose solution is normally available in market in the 5%, 10% and 25% preparation. Third one condition is when there is a bradyarrhythmias, in which drug of choice we use as a atropine. Atropine normal dose rate in the clinical practice is 0.3 to 1 ml per 20 kg body weight. Fourth one is the complication that we face at a pet clinic in an emergency condition is ventricular tachycardia, in which we can use lidocaine injection at the dose rate of, in cats we use at a 0.25 to 2 mg per kg IV, or we can use its boluses at the rate of 0.01 to 0.04 mg per kg per minute. Next one stage that we face during our clinical practice in the emergency condition, pulmonary emergency. Pulmonary medical terminology is normally used for the respiratory problem. If we are facing a respiratory arrest, we can use injection Britanil. Britanil is an emergency bronchodilator that is used commonly in the case of respiratory distress. Along with this, we can also use a doxapram. Next one emergency is a metabolic emergency. In metabolic emergency, there are three categories: anaphylactic category, hypocalcemic category, and hypokalemia hypoglycemic category. As the name indicates, in case of anaphylactic emergency, metabolic emergency, that is subcategorized as anaphylaxis, we can use adrenaline at the rate of 1 ml per 10 kg body weight. In case of hypocalcemia, we can use calcium at the rate of 0.5 to 1.5 ml per kg body weight of 10% solution over 20 to 30 minutes. In case of hypoglycemia, as the name indicates, there is a low concentration of glucose in the body. That's why we can use glucose 1 to 5 ml 50% dextrose IV slowly. If dextrose 50% is not available, we can use dextrose 25% at double dose as comparison to the 50% dextrose IV over 10 minutes. And third one option is the dextrose 10% and dextrose 5%, and last one option is the dextrose saline. If hypoglycemia is very severe, then we will go for the high concentration of dextrose like 50%, and respectively afterward 25%, 10%, 5%, and dextrose saline. If we don't have a dextrose fluid available at our clinic in the 500 ml packing, we can use normal saline and a 1 ampule of dextrose 25% in the packing of 25 ml. We can infuse that 25% 20 or 25 ml packing mixed in the normal saline to cover the hypoglycemic patient. Next one emergency is the neurological emergency. In case of neurological emergency, there are always nervous signs that we are facing at a clinic. And in that nervous signs, diazepam with the name of injection Valium in injectable or tablet form, these are used as a epilepticus control, or we can categorize it as an anti-epileptic medicine. Second one medicine that can we use in the case of neurological emergency, midazolam, and last one will be the propofol. These are some common medicines that are used in case of a neurological emergency. And mannitol is also used in the neurological emergency. Next one, last emergency is the anesthetic emergency. Anesthetic emergency condition is covered and restored or rehabilitated by using the antidote of anesthetic drug. If we are using any anesthetic drug in our clinic, then we have to use antidote to reverse and to neutralize the injection, anesthetic injection, and its overdose. Normally, Yohimbine is the antidote of Xylaz, and Xylaz other name is Rombin. This is an example when we are using antidotes against the specific anesthetic agent. And some are the common anti-anesthetic drugs are reversing agent naloxone and other drugs that can be used in case of an anesthetic emergency. But our first priority will be that we are which one anesthetic drug we are using and what will be its antidote. We should make sure that antidote is available before injecting anesthetic medicine to the pet. This was all about today's lecture about the certain emergencies and basic guideline. For complete guideline about the emergency conditions of the pets in a clinical practice, you can join us our in online Captain Vet training program, that is a project of Colvet SMC Private Limited.